My name is Shelby King. I'm the VP of In-Home Services for Freudenthal, and I am a licensed master level social worker. I've been a social worker for 30 years. It's hard to believe, but and I've been so blessed with the opportunity to work in so many different healthcare entities. I've worked for a nursing home. I've worked in hospitals. I've worked in home health, hospice. I used to work for the Area Agency on Aging. Um,
My name is Caitlin Radka. I am a medical social worker for the home health division. I am a master's prepared social worker. I worked at Mosaic Hospital for 5 years before joining the home health team in July.
Hi, my name is Stephanie Nold, and I am a social worker for the hospice division with Freudenthal. I have a bachelor's degree in social work, and I have worked for 20 plus years as a social worker at the hospital in a variety of areas, and so kind of what they call seasoned, which is code for experience. So
every year, the National Association of Social Workers puts out a theme for social workers. And in 2020, the theme is social workers across generations. I I read it early this year, and I absolutely love the theme because social workers have a bad rap out there. Meaning, sometimes when people think of social workers, they think of, oh my gosh, I'm gonna, put you in a nursing home, or I'm gonna take your kids away, or I'm gonna, take your money, or that type of thing. There's just so many misconceptions. I feel like I've used my whole life trying to teach people that we are just the opposite, exactly the opposite. We are trying to keep you at home. We are trying to keep families together. We're trying to get resources for you. And so, the social worker across generations, it means a couple different things. It means, first off, we can work with you from baby all the way up to the dying person. Across generations means social workers have been out there for a long time, a really long time. They weren't called social workers to begin with, but they were helping people. And so of course, I'm a social worker. I'm going to talk really great about our profession, but man, we're so needed. I mean, especially in times like that, we have COVID-19 in 2020, and we're going to be needed more than ever after all this chaos is over, because people are going to be struggling to get back to work. They're going to be struggling with insurances and money and food and all the things that we're experts at. And so I can't even express to everyone out there how important social workers were before, but now more than ever. Whenever someone calls Freudenthal, the main number, 676-8050, it comes in to me. And I can't even express to you how much I love taking that first phone call. If you do get me, yes, you're probably going to get 20 questions from me, but I really want to find out, first off, what you're calling for. And then with the questions that I ask, sometimes it goes into something totally different that you didn't even realize that we could help you with. Like, take, for example, I got a call a couple of weeks ago from a woman, and she was just distraught. She was crying, and she said that she had called like 40 places literally, and she was home from a skilled facility, and her husband needed transportation to dialysis. And she said that she could probably do it, but she was weak herself, and she didn't want both of them to end up on the ground. And so she needed help just during a brief period till he got well enough to do it on his own. And so, exploring with her and kind of being creative, that's another thing that social workers are so good at, about, is just being creative. Sometimes, the resource isn't there, so we have to work with other resources and just make up something. And I know that sounds really crazy, but we do. Sometimes we have to make it up as we go. And so for them, we got them a service to where someone was going over in a brief period and helping him into the car, and then waiting until after he was doing dialysis and helping him back in the car, and then helping him back home. There was a lot of transportation services out there that couldn't do that brief thing, but because we were creative and found an individual to do a certain aspect and an individual to do another part of it, it worked. And so social workers that's one of the things I'm so proud of us, meaning sometimes we have to think outside of the box. Sometimes it has to be something that's maybe part of a resource and part of another resource, and calling people that and coming together to meet that need. And so, yeah, you're going to get me, and you're going to get pointed in the right direction, hopefully. And we're just going to try to surround you with every resources that you possibly need to succeed, basically. Once I realize what resources you're needing, you might be referred to a home health social worker or a hospice social worker. At that.
So there are multiple referral sources. It can come directly from the doctor upon admission. It can come from our in-home team through Shelby, or it can be obtained by another part of the home health staff that sees the need for a social worker. And I would say across the board, our goal is basically to help families however we can with whatever goals they have set for themselves. That could mean that we load them up with resources in the home. That could mean that they be transferred to a facility, assisted living or long-term. It's whatever the goals of the family and the patient are, is what we try to do our best to meet. The situation that comes to mind is an elderly lady who was not sleeping very well at night, and she had attributed it to multiple comorbidities. Turns out her mattress was the cause, and I was able to find her a new mattress that was donated from our community, and she told me that that had made the entire difference, and she was able to sleep better. Her outcomes with physical therapy and occupational therapy were better. Her quality of life had significantly improved over something as small as a mattress. Every assessment is very, very different. Yes, they are all in person. I can do a lot of my job over the phone, but especially at first, it's very important for social workers to see the environment, to see the family dynamics that go on there, and see what best ways that we can apply our skill set. Pretty much the same, multiplied by 10. People need resources. People need short-term therapy. There's a lot of anxiety going around right now across the board. And that is definitely something that social workers can sit down with families and try to help with coping skills and effective ways of getting through this together.
It is, hospice social work is different. I mean, we are looking, we work pretty closely as a team with our families because we're going into someone's home. I mean, that's their personal space. And so we work very diligently to make sure we're respectful and that we are following someone's wishes and they're meeting their goals for care. Hospice social work, we do a little bit of everything. We are there for emotional support and resources, during a time when you're caring for someone at home. It's difficult to get out and do things, so we will help out with trying to find resources to keep people at home and supported. Well, for hospice social work, it is important that we are very careful of protecting not only the team, but our patients and their families. So we've got a lot of people in nursing facilities, and most nursing facilities have made it to where they're locked down and only the nurses can go in. And so families aren't able to go see their loved ones there. So we are connecting the families as best as we can. We're brainstorming. We're trying to be creative to keep those connections going, whether it be painting a sign or trying to FaceTime if we are allowed in there, and spending a lot of time with the families to reassure them that we are helping watch out for their loved ones. Yes, with hospice social work, we are there for not only the patient who is sick, but we're also there for their families. We are there to address the needs of the whole team, the multiple generations of families. There could be the kids, grandkids, brothers, sisters, and so this when someone is dying at home, we are there for their entire family, and we are even there for them after someone does pass away for over a year. With hospice, our goal is to try to help someone live the life and have the best quality of life that they possibly can. And that is not all doom and gloom. It is trying to do maybe some things that you've always wanted to do, or, have some fun celebrating your life and celebrating your family and your connections you've got. And so we did, one of our patients, she lives in a nursing home, and something that we would take for granted, a shopping spree, was something that we worked on and made that wish come true. Another lady we had never really had a big birthday party, so we had a really big birthday party for her. It was really a lot of fun. She loved murder mysteries, and so we had a big event celebrating that. But it doesn't have to be something big. It can be something small, like somebody loves lemon cupcakes. And so we would, you might come and celebrate, and maybe an anniversary with cupcakes, and we might sing, or we might do something fun, or it may be someone's always wanted to go on a riverboat cruise, and we try to help coordinate things like that.
Social workers wear many hats. On one day, we could help with financial situations. Maybe you're struggling, maybe you need food, maybe medications are not affordable to you. Another day, we can be providing therapy for any sort of mental issues that you might be facing. Yeah, we do it all. Anything that you need, we're here for you.
We do address, there are some very practical needs that people often don't consider, because a lot of times if someone's coming onto hospice, it is a very emotional time, can be even a time of crisis for people. So we try to help with, there are some very practical things that need to be addressed, like maybe power of attorney paperwork, or some legal aspects that we talk to people about and kind of direct them. Just thinking about little things like passwords on accounts, or just managing the day-to-day activities, or also looking at what kind of support will you need maybe in the future. And so we will explore options and help with connecting resources to people. One of the things that I really love about social work is it's not the same job every single day, that you are always can be challenged, and to be creative. And you might go to someone that you're working with and go, okay, I know this sounds a little crazy, but bear with me. What do you think about this? And and then what people don't see is the hours you might spend behind the scenes making phone calls and checking things out, and trying to take as much of the burden off of the person you're working with. And present them with something that might be an option for them. With Shelby, social workers are everywhere, and we are here to help people and to serve people. I mean, that's our whole focus on everything. And we're, like Shelby said, we're in schools, the medical profession, nursing facilities. The social workers are everywhere, and so we are here to help, and we try our best to do what we can to help people and give you options.
Okay, I need a script here. No, I'm serious. Go ahead.
I love you so much.